How do you treat a jellyfish sting?
Sure. So doctors might consider a few things when they are treating jellyfish stings. That depends on the patient's history, how severe the symptoms are, where on the body the folks suffered the sting, where in the world the patients find themselves. Okay. So for example, folks that experience a jellyfish sting out in Australia or the Indo-Pacific area, there's some deadly jellyfish out there. But in other parts of the world, typically a little more mild case. So generally speaking, a doctor might first advise get the patient out of the water and assess the need for things like CPR. Do you need to activate that emergency response, get an ambulance on site for those severe cases? So that's kind of that first step, airway, breathing, circulation. In the more mild cases, really it's pain control and observing so that they don't have a delayed reaction. But for folks that have those severe cases, they get in the ambulance out to the emergency room. The emergency room physician then goes through their process, ensuring that they're, whether they're alert, whether they've got any heart issues, so whether they need medications that could be life-sustaining, that sort of stuff.
What if you just step on a jellyfish as you're in South Padre Island or something like that, one that's washed up, and you get a sting from that? I mean, is there a rule of thumb for what you should do? That's
a good point. So usually we tend to see kind of in this area maybe more of these mild cases, and again, it relates to pain control. One thing that is fascinating is that there's about 150 million people every year that get stung by jellyfish. Wow. And it's usually us kind of invading their territory, right? Jellyfish don't tend to attack human beings. So one of the best ways to prevent a jellyfish sting is if you see those tentacles, avoid them, and then know your waters in your community. Avoid going into the water during jellyfish season.